My name is Dr. Me, the Medical Director of the Richards Clinic. I welcome you to this exciting lecture. For today, we are going to discuss a topic that is really very important. It's a topic concerning a question I have received from many people concerning why drugs do not work when it comes to chronic joint pain. Truly, there's nobody who has pain and folds his or her hands without doing anything about it. But majority of people that suffer pain are on drugs, are on medications, and yet they don't get better. And the question is, why? And that's what we're going to look into today. In this topic, why drugs fail to stop chronic joint pain. Now, before we go into the meat of the matter, let us define pain. Let us coin a definition for pain. Actually, joint pain is an unpleasant sensation caused by actual or potential tissue damage. If you look very well, the words tissue damage are highlighted here, meaning there won't be any pain if there is no tissue damage, either actual tissue damage or potential tissue damage, meaning that the tissue is about to be damaged or wounded, or the tissue has already been wounded. Typically, that's what happens in the joint. Now, let us differentiate it. When, imagine I have a fall and I have a pain. The pain that is developed as a result of an injury or something that just happened is called an acute pain. But if the pain lingers on for more than 3 months, the pain becomes chronic pain. So in acute pain, as I said, the pain is less than 3 months. In this situation, there's no significant tissue damage. In the joint might be swollen because of inflammation, and to stop the pain, just treat the inflammation. Therefore, if you use drugs that are called anti-inflammatory drugs, the typical painkillers we know, they are all known as anti-inflammatory drugs, you will feel better. Why? Because in acute pain, inflammation is the main problem. You hardly do have degeneration. If there's degeneration, it is very mild. But the major problem or the major cause of pain in acute pain is actually inflammation. Now, if maybe the injury I sustained lingered on and continued to cause pain, by the time it is 3 months or more, it has become a chronic pain, typical of what happens in the joint. So it has become a chronic pain. At this point, there's significant tissue damage. The joint is mostly degenerated at this point. What do we mean? The structures of the joint, like the ligaments, the cartilages, the capsule, all the structures of the joint might have started developing some form of or some degree of degeneration. At this point, to stop the pain, you have to treat the degeneration. Okay? Yeah. If you graphically represented, you could see at this point, degeneration is now much more than inflammation. Why at this point, inflammation is much more than degeneration, which means the treatment I'm going to use here will be different from the treatment I'm going to use here. Now, let us see, how is pain generated? Okay, from what we just described, first of all, there will be a tissue damage. It might be a sudden impact or something that has gradually built up with time. Okay, so with that tissue damage, there will be increase in what is called the COX enzyme. It's the chemical in the body called the COX enzyme. And what do? The COX enzymes increase production of another chemical that's called prostaglandin. Okay, and the prostaglandin are responsible, with other chemicals in the body, responsible for increase in pain and inflammation. And because it's a vicious cycle, since there's inflammation, inflammation will also encourage more tissue damage. This whole cycle will go on and on and on. But what do people do? When one has pain, the first thing in your head is to stop the pain, whether acute pain or chronic pain. So we resort to painkillers. And all the painkillers we take, they fall into these three categories. NSAID, the non-steroidal anti-inflammatory drugs, just as I mentioned earlier on, your diclofenac, your ibuprofen, Advils, majority of the pain commonly taken fall into this category. Now you have the steroids, the prednisolones people take, the dexamethasone, some of them come as injection, which some doctors inject into the joint, and you feel better, and you think that is all. No, it's just a painkiller, and it has not solved the problem at all. Then you have your tramadol, the codeine, which are the opioids. So these are the things people take. But how do they work? Just look at this diagram. I have taken the medication. This is the tissue damage. All these drugs jump the source of the problem. The NSAIDs and the steroids, they go here to do what? To decrease or stop the production of COX enzyme. Now, if you take opioids, this is where they work. They try to reduce the effect of the chemicals produced here to cause the pain or inflammation. So if you study this very well, you now find out that the root cause of the problem was not affected at all. Therefore, when you jump and start working from here, any leftover will still come back here. And this one will continue to generate this. Because since it's still here, it will continue to generate these things as mentioned in the previous slide. Okay? Now, the options of treatment. You can understand from what we have said earlier on. At the acute stage of pain, I just had an injury, I had a fall, something hit me, I'm having pain, it just started, or even in the early stages of arthritis. What happens when I take painkiller, I feel fine. Why? Because all of them act at the inflammation. And at that early stage or in acute stage of pain, inflammation is the major problem. These things are the treatments you can use to reduce inflammation. Painkiller, you rest the joint, maybe exercise, or warm and cold pack. Just apply some warm pack or cold pack around that place and you feel better. Because why? Inflammation is the major problem. Now, this is where the problem is. These painkillers and medications we use, when your own joint pain has gone beyond acute stage and entered chronic stage, you still go ahead to use this method, they will fail. Because why? It's no longer inflammation that is a major problem. Inflammation is very small here, though it still contributes to the pain. That's why some people that have chronic pain, before they go out in the morning, they take some painkiller and they feel better, and then they can go out and come back and the pain starts all over again. They could go out because the pain medication they took reduced this inflammation a bit and they felt better. But the major source of pain at this acute stage, at this chronic stage, what we call the late stage of arthritis, is degeneration. Why your drugs fail is because the drugs that work at this early stage is still what you're using at this late stage. It's not going to work. So, because degeneration is the major problem, there are only two options of treatment at this point. Either you do regenerative therapy or you do surgery. You understand? Either regenerative therapy or surgery. Therefore, the bottom line is, as long as the tissue damage is not repaired, pain will continue. Which means, if the pain is not treated from the root cause, you have not started the treatment. So, just to recap again, these are the ways all the drugs work. Because we are taking those drugs and you are wondering, I started with one, the doctor had to increase this to 2, and at a point none of them is working anymore. It's because there is a vicious cycle. Because of the fact that this tissue damage has not been repaired, the vicious cycle will continue. So all these things will be getting bigger and bigger, from small tissue damage to bigger tissue damage, because the inflammation will end up coming to encourage the tissue damage. So COX enzyme will be increasing, prostaglandin production will be increasing, and everything will be getting bigger and bigger, and that is the vicious cycle. What are you supposed to do? I'm using knee as a model. What do we say? By healing the tissue damage, you can cure the pain. Why? Because by healing the tissue damage, you are treating the pain from the root cause. I'm using PRP to demonstrate this, as part of PRP is a type of regenerative therapy. So you get PRP, which stands for platelet-rich plasma, which you get from the patient's own blood. So it's natural, it's from the patient's own blood that this PRP is produced. So the platelet contains growth factors, and these are the growth factors: VEGF, HGF, TGF. There are many of them, more than 12 of them. So when you inject it, they release these growth factors, and they begin to act on those degenerated ligaments to regrow them. The cartilage, the ligament, the capsules, the structures of the joint that have been damaged by arthritis, the growth factors will begin to regrow them gradually until the joint heals. Okay? So, very important. This is how PRP works. So, as you can see, all the drugs we mentioned start working from this stage. But by the time you inject PRP, it starts working from this stage. So you can see it's treating the problem from the root cause. By the time you inject the PRP, it releases the growth factors, just as I mentioned, and they begin to work on the tissue damage. So when you repair the tissue that is damaged, all these reactions will no longer be possible. They can't happen again. And that's how arthritis can be treated. So I'll leave you with this. If you want to get well from pain, from chronic joint pain, if you want to get well from arthritis, don't just treat the pain. Treat the cause of the pain. Thank you very much for your attention, and I wish you have you again in our next lecture, because we need to know, we need to understand, we need to work so that we push down all this menace of joint pain in our society. Join me once again. Thank you.